Friends, today I'm going to talk on gut flora and Parkinson's disease and how the gut can affect our Parkinson's disease. So in last few years, I should say, there's a lot of mounting evidence that the disease might start from the gut. And this is because the biopsies taken from the gut in Parkinson's patients, even 10 years before they had motor symptoms, have shown that they had Lewy bodies in their gut nervous system. Now, the Lewy bodies are the hallmark of Parkinson's disease, which is seen in the brain. So, if it is there in the gut even before it is in the brain, that's just a common sense that the disease might start from the gut. Now, we don't know why the disease starts from the gut, whether it's a toxin or whether it's a virus or whether it's a slow viral disease like proteinaceous infectious particles, which we call as prions. However, we know that the disease starts probably in gut and then it spreads into the brain through the vagus nerve. And the interesting part is that there are studies in which they have found that in patients in whom the vagus nerve has been cut for other reasons, which we call as vagotomy, they don't get Parkinson's disease. So probably there is a spread of disease from the gut to the brain. And a lot of Parkinson's disease patients would admit that even before they had their motor symptoms, they had some gut symptoms, namely mainly constipation. And people who are having really bad constipation, it is a poor prognostic indicator for their Parkinson's disease itself. There are many reasons for this constipation as well. You know, in Parkinson's, the movement of the gut is slow, which we call as gut motility. So when the gut motility is low, the emptying of the bowel, emptying of the gut is very slowed down. So it makes a common sense that we should eat fiber, which is eat diet which is rich in fiber, increase our water intake, do regular exercise, go for walking, which can take a good care of our gut. Also to note is that when a person is having constipation, there is undigested food, toxins in the gut, and which we call as leaky gut syndrome. Those toxins can get into the system in Ayurveda, which they call as ama. And when it builds up, it causes disease. So it's important that we should have regular bowel movements, especially if you have Parkinson's disease. Another important part is that when you are constipated, it also decreases absorption of your Parkinson's disease medications. Another important point to take in mind is that when you eat a proteinaceous high protein diet and you take your levodopa medication with it, there is a malabsorption of the medication. So try to take your medications empty stomach.